Very high tech. So from one mode, you can send it to different apps. Wow.
Yes, yes, yes. Okay, so hi everyone. So let's just stay silent for a few minutes, wait for the other students. So the first thing that you sent me, Dr. Kwok, is just to sign up for the mailing list
Yes, for the newsletter from
for the
University of
newsletter.
the West.
Okay,
Yes.
so I'm going to be posting that. So that's the first link.
Mhm. And
Uh,
it's going to be on the last slide of my PowerPoint presentation too, in
Okay,
case anyone wants to
okay.
copy the link from there.
So we are actually live now on all the channels. So let me post the first link. And the first thing is to sign up for the newsletter with University of the West. Let me see if I know how to do that. Okay, so welcome everyone. Very excited to have Dr. Kwok to be our speaker again. And this time, again, talking about psychology and particularly about some of the myths about psychology. So with that, I'm going to give the podium to Dr. Kwok that can take over.
Thank you, Danny. Good evening, everyone. Venerable Di Hong and all the guests who are on the platform right now. My name is Joanne, or I'm commonly known as Dr. Kwoh at University of the West. We are based in Rosemead, California. I'm also a registered psychological associate. And what does that mean? It means that I'm a practicing clinician under the supervision of a neuropsychologist. So I see clients. And I'm also a consultant to YWCA San Gabriel Valley. This is a nonprofit GM government, grant-based organization in Covina, California, which was where I used to work as a senior services care manager. So ever since I left YWCA San Gabriel Valley to work at University of the West as associate professor and chair of the Department of Psychology, I have remained actively involved with them, conducting community mental health workshops such as this one, not just in English, but also in Chinese Mandarin and recently in Cantonese, thanks to Venerable Di Hong and Dr. Danny Miu. So tonight it's our second workshop. The first one was last quarter, way back in March, where I talked about mental health 101. And tonight our topic is on myth busting. So we are going to call this workshop Mental Health Mythbusters. So psychology is a field. Psychology can be about, different schools of theories, but mental health is a huge part of psychology. In the past 20, 30 years, people, when we talk about psychology, the first concept is usually negative about what abnormal behaviors are. And then slowly the terms mental health evolve from behavioral health. And then these days, when we talk about mental health, we no longer look at mental health as something that is a negative aspect of our lives, because mental health is everything that you and I share. Mental health, in fact, to me, it's a fundamental human right. And that's why my journey to obtain a PhD in clinical psychology is not only just to teach and perhaps also to treat, but mainly to help carry the knowledge to our commonplace to share with everyone who lives in our society and community. So tonight, we will be talking about 10 common myths about mental health. And actually, I have an interactive way of conducting this workshop. It was first done in person, and then it was conducted online. And then I would have people answering my questions. So let's see if that happens this evening. If from the other platforms we can't have this kind of interactions, maybe then I'll need Dr. Danny Miu and Venerable Di Hong to help answering some questions on behalf of the attendees today. So before that, let's have some community guidelines. I know most of you are not able to speak per se, but if we can, if was in person, we usually have one person speaks at a time. We are respectful. We have no judgment. And we are gentle with ourselves and others. Now, when we speak, of course, then we are talking about being gentle, being respectful, being mindful of how we use our words, not only just with other people, but sometimes also with ourselves when we have those internal thoughts. Maybe you see some scenario, you come across a case that we're talking about, and you said, "Oh, that's me. I'm such a terrible person." Be gentle with yourself. Let judgment be free in this zone, and when we can share with each other about what mental health is all about. And confidentiality. I remember the last quarter when we talked about Mental Health 101. This is a little extended into how it applies in real life. I remember Danny sharing about a person in his real life social circle about how to share a situation in the life. I can't remember the incident, but there was an audience, a person in the audience who expressed their gratitude about Danny being respectful of the confidentiality, saying that, oh, I have permission to share this. And on the other hand, whatever we share here, maybe sometimes we might share a case. It's more for illustration and more for deeper understanding, and not for us to carry back into our lives and say, hey, I heard about Danny doing this and that. It's not for that purpose. It's more about how we can deeply or understand more deeply what we are discussing at hand. So the objectives today, we have three. One is to be able to debunk some mental health myths. Two is to identify at least one way to help your friend, our family, and our loved ones. And three, we can identify two ways of treatments. Not that we can treat, but we can identify how our treatments provided for certain kind of conditions or situations. Are you ready? First myth: mental health issues do not affect me. I have come across some people in my life. I don't want to be political, but I think the first one that you can come that comes to your mind or you can think of is the president of this United States. I think he doesn't think mental health affects him. Okay, bringing back to this, um, without talking about politics, I'm just giving you an example. There are people truly in real life situation that really don't think mental health issues affect them. So do you think that this is a myth or this is a fact? Anyone wants to try and answer that? Can anyone answer that online?
Someone says myth, and yeah, many people at the Inside Timer definitely says myth.
Okay,
Oh,
thank you.
it says effect.
Someone say it's a fact.
Yeah, it's
Okay,
effect. Another person said effect.
okay. So far we have 80-20 kind of situation.
Mm-hmm.
Thank you so much, Danny, for being my right-hand person on that because it will only be more interesting if we have that kind of interaction. Are we ready to see the answer? Let's go. It's a myth. So here are the facts. Mental health issues can affect anyone, including you and me. In 2020, 1 in 5 adults experienced a mental health condition in a given year. 5 years later, we haven't collated the results or data. I can only imagine it's on the uptick trend. 1 in 5 young people have experienced a major depressive episode. Now, if this young person lives in your household, when any one of your household members has a depressive episode, it doesn't only affect that person, it affects everyone in the household. 1 in 20 Americans have lived with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. Sorry. Schizophrenia, bipolar disorder, or major depression. Now, there are many types of mental illnesses out there. We are talking about from mild, moderate to severe. And schizophrenia is a thought disorder, and also it's a disorder that requires medication management. So is bipolar and major depression. So we usually categorize them under serious when it needs psychiatric help as well, meaning they need medication management. So 1 in 20 Americans have lived with a serious mental illness, and you can only imagine how that affects their family members or their friends when they have a serious mental illness. Okay, let's go to the next one. We have 10 of them, in case you're wondering. Suicide is a leading cause of death in the United States. Suicide is a leading cause of death in the United States. Myth or fact?
One person say true, the other person say fact. Another fact.
So I believe
Fact, fact, fact,
truth,
fact, fact.
yeah, truth and fact are, interchangeable. And you're all correct. Suicide is a leading cause of death in the United States. It is not the number one cause, but it's one of the leading causes of death in the United States. The other leading causes could be physical illness. In 2020, it was the second leading cause of death among people of the ages of 10 to 24. Now, I want to kind of interject here. In the 15 to 20 years that I've been teaching, when I talk about suicide, the number one population or demographic that always shows up as the leading demographic or group that would commit suicide or that they die by suicide, it's older white male. So this trend that in 2020 it's a leading cause among 10 to 24 years old does not overtake that. But among the young people of 10 to 24 years old, suicide became the second leading cause of death during that period. I'm hoping that that trend is not continuing. I don't have the most collected or updated data right now, but I'm hoping that that is not a trend. However, among LGBTQIA plus youth, it is quite a leading cause of death. All right, the next one. Children can experience mental health issues, myth or fact? Children can experience mental health issues, myth or fact?
Yes, followed by full fact. Full
Okay.
fact. 100% fact. You got okay, that's pretty old. Yeah, we got
Yeah.
that.
I think Vandy and Danny and myself, we come from a generation that children are to be seen and not to be heard, and we feel like they are a different species. They should not experience the same thing that we experience. But we forgot that they are also humans, just tiny humans. So they have the susceptibility, the vulnerability to also mental health issues. So it is a fact that even very young children may show early warning signs of mental health issues. I have watched a documentary of a 6-year-old girl who lives with schizophrenia. And fun fact for you too, autism, which is now known as autism spectrum disorder because it's a huge spectrum of how behaviors of autism can present, used to be considered, this is many years ago, 60 to 80 years ago, used to be considered childhood schizophrenia. So children with autism were so misunderstood that they were labeled as children with schizophrenia. Their mental health issues are a product of multiple factors, biological, psychological, and social. Half of all mental health disorders show first signs before they turn 14 years old. Among people who live with schizophrenia, the males usually show the first signs before they turn 20. In females, they can show up after age 25, though. Okay, I'll let that sink in for a little bit. Take a deep breath out. Let's go to the next one. I think this is our fifth one. People with mental health conditions are violent. People with mental health conditions are violent. Myth or fact? This is an interesting one. Might be some
So
division.
far, two myth, three myth, one myth conditional. It says depends. More myth, more myth. Wow, overwhelmingly myth.
They are
Sometimes true,
very,
but that is definitely not always.
Yes. They are definitely informed. They have read up. I mean, sadly, that, cases that we read in the news, in the papers, and social media, when we see a violent incident, and usually the perpetrator has some kind of mental health issue, but that doesn't mean everyone or most people with mental health conditions are violent. Definitely not the person next to you, because a lot of us live with mental health conditions that you may not be aware of are not violent. So, most people with mental health conditions are no more likely to be violent than anyone else. Only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. People with severe mental illnesses are over 10 times more likely to be victims of a violent crime. So, the other way around than the general population. So, imagine people who are transient, unhoused, or commonly known as homeless. They have a mental health challenge, and then they became unhoused, and they become home victims of crimes instead of being the perpetrator of violent crimes. All right, good job on getting that one right. And I do agree with sometimes it depends, because like if we need medication to manage our severe mental illness and we are not medication compliant, that could lead to hallucinations and different behavioral issues, and that might lead to violent acts, but not because of the mental health illness alone. Myth or fact, people with mental health conditions are highly active and productive members of our communities. You think that's true?
It's a good comment. It says, well, it's true because movie perpetuated that myth.
So,
No,
so,
most of them are fact. Most of them are fact. Yeah.
so,
True.
so that comment is saying that it is a myth, but movies perpetuated that or something like that. I didn't understand that. Can you say that again, Danny?
Oh, I think most of the answers are that it is true, that it is a fact. But that's one person said that that is because the popular media, including the movies, perpetrated that fact.
Mm. I
So
wonder if anyone had watched a movie called A Beautiful Mind. It's
anyone?
A
Yeah,
Beautiful Mind.
beautiful mind. I do. I do.
By Russell.
Yeah.
What is his name? Full name is Russell something, the Australian actor.
Yeah,
It's
yeah.
how it's how I understood
Russell Crowe. Russell Crowe. He
Russell
got a
Crowe.
lot of
And I think he won an Oscar for that too. And
yeah, it's a great movie. Yeah.
yeah, it's a 20 to 30-year-old movie, and that's based on the true story, if not according to the live events of Dr. John Nash, who unfortunately died about 10 years ago. I was so sad when I heard about the news that he died in a car accident with his wife. So he was a brilliant scientist. If you haven't watched the movie A Beautiful Mind yet, he was a brilliant scientist, but he was so debilitated by schizophrenia. And this is leading me to telling you that yes, we have a lot of high functioning individuals in our environment, whether it's work, social, even in our family. They do have a condition, but they are highly functioning because they manage them. So I do know people who are holding positions such as executive assistant, and they have a mood disorder. I know some people who live with schizophrenia. This is amazing to me because with schizophrenia, you usually have hallucinations, and the most common hallucination is auditory, meaning you hear voices, but yet they manage that. These days, they even have service animals, mostly dogs, who would help their human companion identify that any object is hallucinated, meaning if the human or the may I, if I may use the word owner, is talking to someone, if the human doesn't know if that's a hallucination, the dog will actually help the human understand you're not talking to anyone, there's no one there. So they actually can function with help. So to illustrate more, you probably know someone with a mental health condition and don't even realize it because they are managing their mental health well and are highly active and productive.
We have a very good comment here.
Let me hear it.
Yeah, it's actually a first person experience. The gentleman or the lady says, I live with bipolar disorder and it's incredible at times, but I work full time in business development and I'm an artist.
Congratulations to you, and thank you so much for sharing. Mental health conditions, they are human conditions. Then the more we understand them, the more we are able to support them, the more we are able to dispel myths like this. So it has been often reported, such as this case that we are being shared with in work settings, that those who have a mental health condition have good attendance, highly motivated, produce good work. Next, mental health issues are a result of personality weakness, and people can snap out of it if they try hard enough. They can get out of it. They can go for a walk. They can go write a journal, right? Myth or fact?
Myth, myth, false, false, myth. By the way, there was enough a follow comment before I roll off my screen. Let me go back, and it's about able to work, able to function. And it says that I have PTSD and I work in psychiatry, and I'm also an artist.
Excellent. Thank you for sharing. Thank you. So I think this one all of us know already. I mean, I'm not that old. I mean, I'm matured enough, but even when I was going to school, then during bachelor's, I still hear people telling me like, or people around me, snap out of it. Let's go for a walk right now. You get out of your mood soon. Until today, I still hear some people saying those kind of words, although in a very light way, and sometimes they pretend that they are joking. But for most of us who have good mental health conditions or are managing our mental health conditions well, we do need that kind of little booster or an encouragement. Okay, I'll come with you, I'll go with you. I mean, one of my clients, he would actually do a walk around his house only when his friend come over and encourage him to walk every Sunday. But that has nothing to do with the debilitating depressive episodes if depression is the situation. That has nothing to do with a person who lives with schizophrenia and are afraid of the voices or the hallucination that are outside of the house waiting for them. So these are not indicators of personality weakness. They cannot snap out of it if it's severe enough that need treatment and therapy.
There's a very good comment. It says, tell that to someone who has a broken arm to just snap out of it and see how well that works.
Yeah.
Mental health is the same way.
Yeah, or a blocked artery. Snap out of it. Let's
You know,
try it.
I came to San Francisco in the early 70s, and I don't think many people remembers how back in the 70s homosexual was a criminal activity, and you can get locked up and kicked out of your residence if there was even an evidence of homosexuality. And people used to think that you can just snap out of that.
That conversion therapy is still legal in
It's
some
true, yeah,
states.
in some
And
corners of the world, yeah, absolutely.
yeah. And in Malaysia, it is still a sin and an illegal activity
Yeah.
to live with the same-sex partner. So, coming back to this, mental health conditions are not to be associated with being lazy or weak, and many people need help to get better. Many
The
factors.
follow-up comment is that yes, homosexuality was considered a mental illness.
Yeah, it was in the DSM-3 back
Yeah.
in, it was only removed in 1978, not too long ago.
Yeah, God, I just graduated from college.
I can go on and on about this DSM thingy. I mean, the current thing, I've been on a movement to try and see if we can remove that gender dysphoria, which is a evolved term from gender identity disorder. And then there was some other older names before that. But that's for another day. Let's continue with this one. And if we have a little bit more time after the presentation, we can share about what the DSM, which stands for Diagnostic and Statistic Manual of Mental Illnesses, which is like the quote unquote Bible of how we diagnose people. And some of the conditions in there are, we question should they be there, but at the same time, that book is something that helps us. Without labeling, without the codes, we don't get the healthcare that we need. So we'll get to that later on if we have time.
Yes.
Meanwhile, biological factors such as genes, physical illness, injury, and brain chemistry are factors that contribute to mental health illness, life experiences. I think you mentioned PTSD, such as trauma or history of abuse, can cause PTSD, and that's debilitating. Family history of mental health conditions. If you have a family member who has a severe mental health condition, you might be highly susceptible. People with mental health conditions can get better and seek recovery support. You know that already. I mean, that's why I have a job.
There are two comments that I think would just support what you just said. One says that sometimes environmental influences, hormonal imbalances, and other things can lead to similar symptoms as with mental issues. And those can be worked on and fixed, but you cannot generalize and just say get over it on an actual mental illness. And then another comment is that childhood abuse causes PTSD and affects adulthood. It's very complicated, basically.
Of
Yeah.
course. And then there's term called complex trauma, the different kinds of layers of traumas, intergenerational traumas. And actually, there's a study out there that's been done. Schizophrenia. If you have family members who have schizophrenia, you are at 50% or higher risk to also live with schizophrenia. But there has been studies done on people who don't have environmental stress, who don't have life experiences, negative or adverse life experiences, who then do not have that gene expressed and become living with schizophrenia. But people who have negative life experiences and environmental stress will have that gene expressed and end up living with schizophrenia. This reminds me of another movie. I'm a movie buff, The Soloist by Jamie Foxx. Very
The
brilliant.
name? I'm sorry, what's the name?
The Soloist, SOLO.
Oh, yes, 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 yes. Yeah.
Yeah, schizophrenia again, but because of environmental stress, the schizophrenia was full blown, and he could not continue with the Savant condition that he has, which is a very brilliant musician, musical ability. I think at the end of today's presentation, people are gonna go look for all those movies that I mentioned.
This could be another things that we can do.
I don't get any commission, I promise. All right, next myth. There is no hope for people with mental health issues. They will never recover.
Myth, myth,
I think,
total myth, myth. Yeah.
yeah, we know that. I mean, the earlier examples that I mentioned, Dr. John Nash, he is able to manage to carry on a successful life. But for Nathaniel, I can't remember his last name. That's the real life person that the movie The Slowest portrayed. I don't think it was a good outcome for him. I can't remember though. But there is hope. My profession, the number one thing that we do is to instill or provide hope. When there is hope, there is a pathway to recovery. So, studies show that people with mental health conditions get better, and many are on a path to recovery. Recovery refers to the process in which people can live, work, learn, and participate fully in their communities. There are more treatments, services, and community support systems. So, as a practicing clinician, with my training and my observations, the number one indicator that my clients are on their way to recovery is when they find a job. The moment that they get placed in a job, that's the sure indicator of recovery is in the on the lab. And they are, if they manage well, they will lead a successful full life away from the mental health illness. The mental health illness may not go away completely, but is managed. It's just like, me with my heart condition, or someone who has skin issues, or who have a back problem. They'll never go away, but we manage them.
There's a good comment here, and I think it ties to something that we might talk about, which is avoidance. And it's basically it didn't use the word, but the question is related, which is that how do you help someone who's undiagnosed schizo and shows a lot of trait of schizophrenia, but doesn't want to admit that there's a problem?
Okay. Can we bookmark that question and discuss that at the end of this? I think we might have time to talk about that.
Okay.
Thank you so much. All right, couple of myths more. I hope this is interesting and educational at the same time for all of us. Therapy and self-help are a waste of time. Therapy and self-help are a waste of time. Myth or fact? I do know someone in my real life who think that this is a waste of time. Any feedback from the group so far?
Hang on, let me just take a look. Um, myth, false, changed in my life. Myth, and then another myth, and then it says, but you have to be open to them for them to help. And I think that's ties to what I said about avoidance. The biggest problem that we have is to avoid the problem. The hardest thing to do is to listen.
Yeah. You know, among my students, the first thing that they really had a aha moment is when I taught them the place to start is self-awareness. If you're not aware, where do you go? We don't even know. It's just like the DSM, like I say, it's labeling mental illnesses, right? If we don't even know what mental illness, how do we treat it? So we need to be aware and how to get to that awareness, that self-awareness. There's a lot of factors in there, egos, family, cultures, educational exposures that will prevent us from being open to treatment. Because sometimes owning to a condition can, in our own culture, mean that we are admitting defeat. We are losing the battle. But like I said, we'll get to that question about why people avoid being diagnosed. I'm one of those who avoid going to the doctors because I don't want to find out the answers, right? So
Yeah,
let's see.
the latest comment is basically that. He says, I couldn't even see my own problem. I wasn't aware. Bipolar comes with a lack of self-awareness.
Yeah.
The problem is the problem.
See, because when you know what the problem is, you have to handle the problem. If you don't know, then denial is the way to go, right?
Yeah. Mhm.
So now that the facts to the myth is that treatment can vary person to person. It can include medication, therapy, or both, but it is suggested that individuals who are taking medication also have therapy. This thing, I am still learning from country to country, culture to culture, but I do know that when you are assigned a psychiatrist, meaning psychiatrist is a medical doctor who specializes in psychiatry, which is, mental health illness, and they can prescribe medication. Psychologists like me, licensed or not, we don't prescribe medication unless you are in the state of New Mexico and Louisiana, and I think Massachusetts also now is also one of the states that have licensed psychologists with prescribing privileges. That is because they don't have enough psychiatrists to see patients. That's why they give the privileges after those psychologists are trained to prescribe certain kind of medications. Family physicians, they can prescribe some kind of antidepressants, some kind of anti-anxiety medication or ADHD, low dose or not so potent medication. But it's supposedly when you see a psychiatrist, you are supposed to have therapy. It's just that because the psychiatrist has only this much time, they make more money just prescribing people medication every 15 minutes, every new patient. Psychotherapy is 1 hour. You make less money and you need more time. And therefore, usually psychiatrists will refer the patients out to see a therapist for therapy. But then when you ask someone, for example, a child, okay, cross the road and get your rice, make sure you have your lunch. Do you think the child always does that? Maybe the child go buy candies. So it's not always ensured that when someone is going to a psychiatrist is always getting the therapy. And therefore, these days, the community-based model, we make sure that a client who needs medication and therapy have both. And the case manager is kind of like overseeing that model with the DMH model that we have here. It is essential to have a support system during the healing and recovery process. If you do not have family or friends, there are group therapy sessions. A very common group therapy, not therapy per se, a group support would be like AA. Now, AA is a group support. Group therapy is different. Group therapy is working on maybe depression, grieving, anxiety. AA is more of a support group. Nothing, I wouldn't say nothing. It's quite different from group therapy.
It's a good comment here. Kind of ties into your earlier comment about the difference in culture and how people from different background views mental health. And the comment is this: so many of my students, 98% of them international, feel like they cannot and should not seek help because of cultural, generational, gender, etc. sometimes gets in the way.
Yeah. Yeah. I mean, the Asian, I'm being Asian, I understand, mental health, it's almost like dirty laundry. You don't air it in the public, right? And then back in the South, I lived in North Carolina and Mississippi for 16 years total. The black man, they don't even go to a family physician. They don't even go to a general practitioner because going to a doctor means you're weak. The masculinity does not allow them to go check on their illnesses. They just go with it until it writes out, something like that. So it's a culture, it's a mindset, it's something that an attitude that prevents us from being healthier. So, which is the next myth right here. It is possible to prevent a mental health condition. Myth or fact? Might I see a division in answers for this one?
Well,
What about you and Danny? What do you think? Is it a myth or a fact?
someone says myth, and then another person said trick. I don't know what that means. Is it possible to prevent a mental health condition? I think it's possible to reduce the chance of having mental conditions. I don't think
Like
that.
maybe I throw something very specific. Postpartum depression. Is it possible to prevent it? Postpartum depression happens after a woman has given birth. Is it possible to prevent that?
Well, again, this is cultural. In the Chinese culture, um, the woman who's giving birth is often surrounded by other female, especially a mother and so forth. And so my experience is that Asian women who somehow or the other are alone, away from the family, tend to have that. They don't have the support.
I see where you're coming from. You're coming from a social, emotional angle. Postpartum is very biological. It's
Mm,
all hormonal.
mm, 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 mm.
The support is social and emotional. But let's come back to this first and see what the fact says about preventable mental health condition. Prevention of mental, emotional, and behavioral disorders focuses on addressing known risk factors, such as exposure to trauma that can affect the chances that children, youth, or young adults will develop mental health conditions. Promoting a person's social emotional well-being leads to higher overall productivity, better educational outcomes, lower crime rates, and improved quality of life. Let's bring it back to the postpartum thingy. I said it's very biological. Can we prevent it? Yes, because I've lived with 2 episodes of postpartum. When I notice it, self-awareness. When I noticed it, I said, "Oops, this must be it." I went to talk to a health professional immediately. I make sure that my spouse and my mom, who was helping me at that time, understand what's going on. I tried the medication route, it didn't work, but I'm not saying that it was a bed of roses. There were lots of conflicts in the house. Or else it wouldn't be a condition that I need to address, right? There were a lot of conflicts in the house, but I made sure that there was some management and I asked for space. And because of the support that I needed, I sought mental health professional, not actually not mental health, it was my OBGYN who prescribed some antidepressants, which gave me a lot of headaches that I had to stop. And then because I was very fortunate that I was going to school already and was able to recognize a lot of symptoms and a lot of other avenues to manage my episodes. I didn't get worse, but I had one very severe episode that I was suicidal. I was suicidal when my babies that were that little. So it was something that was not because I didn't have a spouse, not because I didn't have my mom with me, not because that I was, making paycheck to paycheck. I was a stay-at-home mom, but still it happened. But it's how we manage it. It's how we manage it.
I think you hit a nerve here because I think there are a couple of comments, obviously from people who have experienced this. One person says, "I had it, PPP. I don't know if it's preventable." The other person says, um, there's PPP that most explant moms don't know about. I don't know what explant mean. I'm so ignorant of this. Um, yeah, another person said, I experienced it. It was a nightmare. And then another person says, oh, that's something unrelated. Oh, it's different. It just says, is social anxiety 100% environmentally caused? I'm not sure that's
Mm,
exactly.
social anxiety in young children, it's mainly because of personality or personal endowments. You know, we all have different personality traits. Some people are shy, some people are more outgoing. You see that in little kids. But if there was a stress factor in the household, then the anxiety will be exacerbated. Like, for example, if the child was pressured to excel, pressured to perform something, or there was a sexual trauma, then the social anxiety will be, out of the roof.
Mhm.
Okay, so sorry, there's one more thing about that fact. You will have increased lifespan. You will live longer when you manage your mental health. Well, just like how we manage our physical health, right? I think this might be my last myth. Thank you so much for helping with the interactions. It's so interesting that way. I cannot do anything to help a friend or family member if they have a mental health issue. I cannot do anything to help a friend or family member if they have a mental health issue. Myth or fact?
Myth, false, myth, false, myth, 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 myth,
Okay.
myth.
It is a myth. You can do something. I mean, for my case, uh, because of my profession, I do have friends, they have now learned, but in the first 10 years when I was finishing my master's and going for my PhD, they were always coming to me with issues. And I have learned to say no very kindly and explain in the psychoeducational way. I can never be a therapist or a person who gives you therapeutic advice. I don't like using the word advice because we are so trained in our school that we therapists do not give advice. We work on your strengths. We let you become aware of your weaknesses. We work on those, but I never give you advice. So when now my friends would come to me, hey, can you give me some therapy advice? I would tell them I am not the person that you come to. But I don't stop there. I tell them what they should do. I tell them that they could look for resources. I can give them resources. I can tell them to look out for signs, but I do not become their therapist. So friends and loved ones can make a big difference by being there in the first place. That you know that they are struggling, that you are going to be willing to help them find the help that they need, even though you are not the person who's helping them. You can reach out and let them know that you are available, even if it's to cook a meal, even if it's to pick up a child for them, even if it's to walk the dog or garden for them. Help them access mental health services because some of them may not be able to read or use the phone or drive. Help them learn self-care and coping techniques. I can't say this enough. I do this every workshop. Self-care means taking care of yourself before others need to take care of you. So self-care can mean shower, brushing teeth, or going for a walk. These are all taking care of yourself before you have needs that require others to help you take care of them. Coping techniques could range from what I just said, gardening, reading a book, listening to music or singing and dancing and playing with my dog. These are my top two therapies. Everybody needs therapy. And when I say everybody needs therapy, some people will shake their head and say, why? Who goes to therapy? Therapy is expensive. Or who needs to talk to a therapist weekly? No, therapy is not just talk therapy. I do talk therapy. Licensed psychologists, LMFTs, LPCCs, these are the licensed therapists who will see you for 50 minutes in person or over telehealth and work with you regarding your emotional and mental issues. And it's like physical therapy, occupational therapy, and that's talk therapy. But you can have other kinds of therapy, like I just mentioned, singing, dancing, playing with a pet, volunteer volunteer, or do anything that enriches the insides, your soul, your heart, and mind. That's therapy, and that's coping. Learn and share facts about mental health, what we just shared here, especially if you hear something that isn't true, then you can help your family or loved one, which I will go back to, the bookmark question about helping someone who has not attained the self-awareness yet to help themselves. How can we share that with them? Not as an authority, but as someone who cares about their mental health. Treat them with respect, just as you would anyone else, just as you would other would treat you. If you have a condition that you have not come to terms yet, how would you want others to tell you? Do you want them to say that you have issues, you need to go see a doctor, or something is really wrong with you? Mm-mm. I will not respond to those well. But we can come up with different scenarios for different cultures, different family values, according to what you know best. Last but not least, refuse to define them by their diagnosis or use labels such as crazy. I don't know if you picked up, but I don't say schizophrenic. I don't say homeless easily. I use person first. I say people who live with a mood disorder. I say people who are unhoused because we recognize them by their personhood first, than whatever labels that help us understand them better. Those were the 10 myths. So maybe let me recap a little bit. Mental health conditions can affect anyone. Suicide is one of the leading causes of death in the United States, probably in the world too, huh? There are treatments for mental health conditions, including therapy and medication. It is essential to support your family, friends, and or loved ones with mental health conditions by letting them know that you are there for them. And truly mean that. Truly mean that. If you're not there for them, don't say that you are and then add to the layers of betrayal or feelings of hurt when you say you are going to be there for them and you're not able to. I'm not saying that you take your word back when you already have 6 kids or 3 jobs and you can't be there, then maybe don't say that you will be there for them, but in other words, in other ways that you can support them. People with mental health conditions are highly active, productive, and cannot be differentiated by appearance only. I know recently there's a common term, invisible disability. So you can't really put a disabled sign and show that you are disabled. And I don't like that word. We call that different ability, because your ability is different from mine doesn't mean that you are disabled. But I know for workman compensation or for medical leave, we say disability. But when we don't have a visible disability, how do we differentiate them? And that's the end of today's presentation. The next one is on understanding anxiety. It will be on the first Tuesday, the next quarter, September 2nd at 6 p.m. I'm checking the time. It's 6:47 p.m. We do have some time for question and answer. Before that, Danny, you shared the link about receiving newsletter from US. This is the same link right here for if you want to know more about what my university does, what's happening around in Rosemead, California, in Southern California, feel free to sign up for newsletter, or you can look me up. I'm very prolific on social media. On LinkedIn, you can find me. Facebook and Instagram, don't look for me there. That's my personal life. I have very strong boundaries. Look for me on LinkedIn. Thank you. I hope what I've shared with you, it's something that might spark an interest in finding out more, of inspiring you to share with other people that you think the information might be helpful for them.
Dr. Kwok, can you remove the PowerPoint?
Sure.
They actually want to see more of you. He said, how come your face is so tiny?
Yeah, that's the thing about Zoom. That's why I brought all my online classes when I started at US. I brought all of them back in person.
Okay,
Give us
let
tips.
me
Yeah.
catch up with some comments here. It says,
Okay.
thank you so
What?
much. That was excellent. Thank you. Great point. A lot of times, uh, uh, people just need someone to listen. Another one comment was, thank you so much. That was wonderful. Do you have any tips on managing social anxiety if I cannot afford therapy? Okay, so this you want some. Thank you, Danny. Okay, that's got that. Can you speak Cantonese, Mandarin? Yes, of course. and Thai, well, not Malay, and also some Persian, right?
广府话、中文、Farsi, Bahasa Melayu, Hokkien, Teochew, no Thai.
Yeah, yeah, yeah. She's got you covered. Really appreciate this presentation. And then the last comment is, wow. There was I want to ask, I want to kind of have a quick discussions about violence. I think very often people think about violence. In my case, my father died of dementia, just basically ultimately the brain failed. And it was a long death. We actually had to spend many years taking care of him, struggling through the difficulties. And eventually I had to find, it was time for me to find some help. And so the first thing that happens when I call someone is that they said, does your father have violent tendency? That was a big thing about dementia. So
Yeah,
the reason I said that is that um, Venerable Dihong and I, Venerable Dihong particularly, I sometimes go along and go to prison. And of course, prison is a very violent place, and we're surrounded by um, long-term incarcerated individuals who's most likely committed murder, at least one. Most of them won't. So it's a very violent place. But when I watch Venerable Hong working in that environment, is that I believe, and Venerable Hong will correct me, I believe that very often violence is based on fear. Starts with fear, you know, fear.
and if you don't mind me using, I hold dogs in the highest regard. So if you don't mind me using dogs as an example right now, I do animal rescue. Okay, so the moment an animal is aggressive and biting and attacking you, it's a fear response. It's a fear response because of what it has experienced before. And the only best way they can protect themselves is to attack you first.
Correct.
So what you said is exactly correct. Aggression is usually stemming from fear because how else will I protect myself? Only when you have the ultimate enlightenment that you believe that you are kind and everyone in your environment is kind and safe, then can you be kind, right? If you don't have that trust, you don't have that security, how can you be kind and trusting in the first place?
So that ties into another comment, which has to do with your comment about as a family member, you know, if you're someone not necessarily mental problem as in sickness, but just they you know, it's as if they have certain limit to their elasticity, and they just kind of to a point where they have so much that they're bursting. You know, it's just like they're having an episode, and a lot of that, you know, from our culture is just expectation.
Yeah.
Whether
I mean,
you have
I
work, you
live.
have so much expectation, you can't live up to the expectation, and then all of a sudden you fall into that, right?
Yeah. So two experiences I can share briefly. I my uncle lives with schizophrenia. So I was about 6 when his first episode happened. So was he violent? No, but he's erratic. He was erratic. So schizophrenia, like I mentioned before, needs medication management. If you are not on medication, your neurotransmitters, the biochemistry is unbalanced. The overproduction of dopamine will cause those kind of erratic behaviors, especially when there's hallucination, meaning they see people or hear voices that are not there, and therefore their sudden moves will be perceived as violent moves per se. But if you understand them better, now let me switch mode to having treated clients with schizophrenia and bipolar disorder, and during a manic episode. I have clients who was right violent in front of me, you know, banging on the elevator door, threatening me to be violent. If you understand the motive of that behavior, then you will be able to counter that behavior. But I'm not expecting everyone to be a trained professional. I mean, if I do expect that, then I'm demeaning, I'm actually undermining my own training. We went through a lot of training to be able to negotiate that. The thing is that we only have 24 hours a day. We need to take care of ourselves. We need to take care of someone who has high needs. You cannot do it all alone. It needs a village. So if it's someone with a very um, with let's say in this case, dementia that you mentioned earlier, people with dementia episodes do have incidents of biting, scratching, pushing, and that's because of fear. They have no idea what's going on in the environment and they need to protect themselves. So, and usually people with dementia are people with age of 50, 55 and above. They are progressive in a world that they're becoming less and less familiar with. And therefore, they become more fearful. And they become primitive.
Yeah. In the case of dementia, this is first person experience, is that the fear comes from their they're not understanding what's going on. And so the only conclusion they can draw is that there is being manipulated. So he
That
doesn't remember where he put his shoes. He thinks his wife is playing games on him. He then doesn't remember his number one son. Then he thinks that this person is a strange person who claims to be his number one son. He's trying to do something. He's trying to get to his, whatever it is. So there's a lot of that. But let me come back to violence, because there was two very good comment, and I'll talk about the second comment first because that leads to the first one. And the person's basically said, I am not a violent person by nature, but I have had violent outbursts when I experience psychosis.
I have had violent what? Sorry, can you
When
say
I
that?
experience psychosis.
Yeah, before that, before
What
this.
we saw that is, I am not a violent person by nature,
Mhm.
but I have had violent outbursts when I experience
During
psychosis.
psychosis. Now, what is psychosis? Psychosis, in other words, is a psychotic episode. When you are in psychosis, you are experiencing a lot of hallucinations and delusions. Hallucinations is seeing, hearing, feeling, or experiencing things that are not in reality. Delusions are distorting what the reality is. The computer can be here, but the computer can be larger, or the computer can be you guys are all talking about me when you're all talking about other stuff. So in that case, you are become paranoid and therefore acting on paranoia to protect yourselves. And therefore, psychosis usually is accompanied with a lot of violent acts
Mhm,
because they're protecting themselves.
mhm, mhm, mhm. So another question is that can diet and a healthy microbiome help with these disorders?
But micro what now?
Biome, biomedicine, biome, I
Oh,
don't know.
biomed.
Biomed.
Biomed, yeah.
Yeah. Okay.
This is
So the interventions are two ways, biomedical or non-biomedical. These are the two big branch. So biomedical means you use medications to treat. The other branch will be psychotherapy. So if you want to treat with biomedications, you have to see a specialist to know exactly because I teach psychopharmacology. Like if you want to treat your eyes, a pink eye, you don't buy a foot fungal cream to treat your eye, right? And vice versa. You don't use an eye cream to treat your foot, right? So if you have bipolar disorder, you don't just take anyone who is prescribed with schizophrenia medication. Most of them are quite similar because we're talking about, mood disorders. But not all psychiatric medication is the same. We recognize the top 20 names out there that, commonly can be used like trazodone, Wellbutrin and stuff like that. But that's medication. See a specialist for the very specific condition that you are diagnosed with and go with that medication compliance. Diet, on the other hand, if you take supplements, know that supplements, even if the best supplements, the most expensive one, the most beneficial ones, can interact with your medication. So you need to talk to your prescribing a psychiatrist or medical doctor about what medications or supplements that you're taking, even Chinese herbs, and of course, cannabis. That cannabis or ketamine these days throws the whole thing out of whack. One additional substance can really mess up the whole situation. So when we talk about diet, it's anything that we put into our system. We drink, we smoke, we eat. Well, even if you eat chili padi, my favorite food, that has the most content of vitamin C. Chili padi, those Thai chilies, the very spicy ones. Anything that can affect your system, whether it's endocrine, your digestive system, is going to affect your well-being, your behavior. So be mindful of what you put into your system. Definitely will affect your behavior. Will it affect your thinking? Not necessarily, not chili. Maybe, well, if I go to the toilet too many times, it might affect my thinking, but definitely affect your behaviors for sure.
There's a comment, there's a question here. It says, how about toddlers who bite and scratches? Is that a learned behavior? That's
Uh,
a tough one.
if I say yes or no immediately, I'm not a good
Yeah.
psychologist.
Either
I have to go.
way, the mom's not going to like that answer.
Yeah, see, biting and scratching, again, I'm going to digress to what I said earlier. It's a protective defense mechanism. Number one, because it's very primitive. We are all mammals. We know we want to protect ourselves. But if that behavior is undesired and not corrected, then it will be reinforced. So if a child is biting and scratching, by the time it became a problem, why was it allowed and enabled for that long before it became a problem?
Maybe not a I don't have, it's been a while since I've experienced with toddlers, but how about a cat?
A cat is
Some
it's
cat
from
scratches. I don't understand.
cat is from another planet. I can
Yeah.
explain.
No, 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 no. That is the right answer. Cat is from another planet. It's definitely not domestic.
They used to be revered as gods in the Egyptians era.
Yeah,
They were
yeah,
gods. Yeah.
yeah. Well, actually, funny. I don't know why we talk about cat, but I had a cat for about 10 days. But my son left her to here for me to take care of while he's out traveling. And I talked to my mom about having a cat for the first time in my life. And my mom says, back in the old days, we always feed the cat first.
Oh.
Cat is divine. Anyway, okay, here's a
Yeah.
good comment, very long one. So let me see if I can understand it. The unfortunate thing is that the violent behavior can lead to people being arrested and getting stuck in a system that does not understand mental illness at all. Incarceration is not the answer and most likely will make it worse. Law enforcement needs a lot more training and to partner with mental health profession. Whoever
Uh,
asked the
yeah.
question is
We,
definitely
we yeah we
that's
can't
from a different planet, not San Francisco.
we can't say that enough. I mean,
That's a
Venerable
great comment. Thank you so much.
will let you know too. When I interviewed for my internship, I was quite set on the Twin Towers, which is by downtown LA. I toured the mental health facility. Listen to this. That mental health facility is the largest facility in the whole country. How many people who are incarcerated are having a mental health condition? That demonstrates it. So we are right. Our system is not designed to rehabilitate. Our system is designed to punish and stop behavior. It's almost like ADHD. Take your ADHD medicine. Stop. Stay in that corner. There is no treatment. It's just to stop the behavior. So I believe what the good work that Venerable Dihong is doing some work. It drops of water into the ocean, but still drops of water. But at the same time, when I was interning at IMCS, which is a DMH contractor, we already started collaborating with law enforcement to train their law enforcement officers to understand mental health conditions, especially in a DV situation, especially in a family dispute situation. Don't shoot first. Understand what's going on first. Then we pull the gun out. So there are efforts, not enough, I know, but we are doing our best.
Yeah, yeah. I think that I guess my after listening to your presentation, I think if I want to summarize it, it would be that ignorance doesn't help.
Mm.
I think we all, if we want to help, I think this we need to help. There's not enough.
Every time someone I know or I don't know, mostly people I know who reaches out to me and say, Dr. Joanne or Joanne, can you tell me who I can go see about this? The first thing I do is I congratulate them for the healthiest behavior to
Yeah.
seek.
No, seriously, it takes a lot of courage to like this is the thing. I'm obviously not a therapist. I'm not even an amateur therapist, but I am a professional family member, and I have younger person and older person come to me, and you just have to recognize that it took a lot of courage to have that conversation. And so what I learned is that first of all, don't judge. Second, don't try to fix the problem.
Very, very
Just listen, damn it.
well,
Be
but you know,
open-minded. Be
thank you
open-minded.
for mentioning the listening part. That's why Venerable Di Hong knows that we have, besides psychology department and religious studies department, and also liberal arts and business, we have a Buddhist chaplaincy department. So the
Mhm.
chaplaincy department teaches or trains Buddhist chaplains, and the number one role is to listen.
Yeah.
Counseling is about listening. And I know chaplaincy also does some kind of counseling and advising. That's
Mhm.
not therapy. So
Yeah.
that's the main difference. Yeah.
Yeah.
So I'm going to be hosting a Chinese webinar in September about Buddhist counseling and the difference between therapy and counseling. So I will give you some information to share with your following and people that you have in your circle so that they can maybe benefit from them. At the moment, it's only Chinese because the request came from the Chinese Buddhist Light International Association members. Maybe in future we'll do it in
Yeah.
English.
Very home. Let me talk about you. You can just stay quiet. I can do your part. So let me talk about Vanderbilt Hall. I mean, the series is I witnessed his work, you know, and Vanderbilt Hall is like a pair of chopsticks when he's among his students. Okay, like you have guys that are 3 times, 4 times the size he is, and they can hurt him by just like holding him up like a pair of chopsticks. Okay, and so the question is that, how does he protect himself among these people? Whether you judge them or not, they're there because of violence. Come on. And violence is the only language in prison. This is how they communicate. This is how they protect themselves. It's,
Yeah.
it's through violence,
Mhm.
either among themselves or with the guards, or violence is it. So how does when I watch Tony Boudin work, and this is what I said, is that first of all, he doesn't judge. You know, he doesn't judge. He doesn't say, why are you there? He's not that. He does not judge. Second is that he listens. He doesn't say like, I'm a Buddhist, I'm a monk, I have this bag of tools, let me convert you into a good person. You can just snap out of it.
Yeah. Just so you guys know, I was in the Lancaster State Prison this morning. Over the weekend on Sunday, one of the guys in a different yard used a man-made weapon, stabbed two guards, two correctional officers. So that guy will never be out of prison. But anyway, so this morning I was waiting for my guys to come out, and one of the guys said, "Hey, D." I looked at him. That when you look at someone and that's a good feeling, right? But I didn't know him. I didn't recognize him. I'm like, this is not good. So as it turned out, I met him in 2018 up in a prison up north, and he took refuge with me. And but that was level 3, but in the yard that I was in this morning, it was level 4. So I'm like, oh, what did you do? I was like, what happened? Like I said, you want to go home, but like you guys said earlier, prison is not rehabilitating, it's not transforming. And then later on, and then I turn around, another guy said, "Hey, Thai, Thai is Vietnamese, it means venerable. Can I have a mala?" And as it turned out, this guy, Vietnamese, big guy, he asked for a mala. So
Mala.
yeah, yeah, beats.
Yeah, Mala, the
Uh,
beat. Yeah.
Yeah. Yeah, so it's tough, it's hell inside. I keep thinking, I just don't know. We can't fix the problem. It's bad.
Yeah. But it is something that it's beyond or more than just mental health. There's a lot of
Yeah.
social, cultural, political, environmental factors of
It,
why incarceration happens. Yeah.
it's the American society, it's the American culture. That cowboy mentality, I guess, it's like, hey, um, yeah.
Well, that's not within my realm of expertise.
Listen, trying to solve the problem, make it a perfect world, that's beyond my pay scale, okay?
No, no.
But
Let's
the
just
thing
let's
is
just do it
also,
one person at a time.
yeah,
Hmm.
and I find, psychology and my values so aligned with Buddhist psychology. It's that we take care of ourselves first before we take care of others. one of the best Buddhist principle of the 26 principles founded by Jack Canfield. The 21st, I think, is tending to ourselves is tending to the world.
Mm-hmm.
So we take care of ourselves. We are part of the world, so we are taking part of the world too. So take care of ourselves, even if we are worried about our family member who has schizophrenia and we are not able to help them realize. You take care of yourself first. Take care of
Mm-hmm.
your health, and maybe by modeling good behaviors, something good might happen.
Yep.
By
Mm-hmm.
slowly providing education through actions, through faith, to
Mm-hmm.
good doings, there might be some transformation going on.
Mm.
Yeah. Mm-hmm.
Very good. I think Venerable Thich Nhat Hanh once says, he believes in interbeing.
Mm-hmm.
We are all individuals, but there's interconnection between us, and some of us feel the pain, and we want to do something about it. You know,
Yep. Mm-hmm.
that's why we do what we do, and that's why we have this class. Is that one way to deal with fear and to understand that part of it is because you feel alone, and you just have to believe that you are never alone.
Yeah. Maybe
Yeah.
all of us are some
I mean,
some kind of
listen,
bodhisattva.
for the first time I heard about Dr. Kwok talk about how she had suicidal, she was suicidal at one point, right? When she was supposed to be the happiest moment in her life, just gave a birth to someone, and then it can happen. It can happen. And a lot of that is just we live in a world where there's so much expectation that we put on ourselves.
Yeah. Life is fluid and life can be volatile. It doesn't
So
stay constant.
I had very recently, I had a conversation with someone that I care a lot about, and she's telling me how, she had this thing, and I said, look, think about it. When you get up in the morning and you put on your shoes, do you tie one shoe first and then the other one, or do you tie them together? And that's what you're doing now, is that you have so many things that you want to do. You put so much expectation in yourself. You want to be the perfect daughter. You want to be the perfect boyfriend, girlfriend. You want to be the perfect doctor. You want to be the perfect, you want to be perfect in all these. And then I said, the best comment I ever got, best advice I ever got, he says, Danny, you can have everything in the world, just not all at the same time.
Mhm.
So I think a lot of that is that it's imposed by the society, it's imposed by the family, it's imposed by yourself. Don't tie the shoes together. Tie them one at a time. Make compromises. I can be a suboptimal son for a while.
Or be like a 2% like me. Don't have shoelaces.
Mm-hmm.
Put them on.
All right.
You need one foot at a time, right? You don't slip it
Yeah.
at the same time.
Mm-hmm.
Okay, all right. Thank
All
you
right.
so much. So if we
Thank
see
you.
you back here, thank you for a lot of making the commitment to uh, uh, see us once a quarter. So the next time we
My,
see each other will
yeah,
be
my
very.
pleasure. And it's my honor to share with all of you. And thank you for allowing me to realize my mission is
Mm-hmm.
to help everyone have the same or equal rights to mental health.
One last comment. It says, whenever we get to that part that I notice that people claim ignorance or that is not in their area of expertise, people just don't want to take the time to learn historical truths that land us where we are today.
Was that directed at me about political views? I'm a very direct person, but really, if
I
I
don't
am
think that
not
is
trained,
directed to anyone. It's just directed to all of
no,
us.
I was just joking. I was just
Yeah.
joking.
So so it's
No,
okay.
but my training,
Yeah.
towards licensure, my training and my number one rule of thumb is that if you're not well versed in that area, the more you say or do anything about it, the more you might be misleading people.
Yep.
So
Mm-hmm.
be very mindful of what you say. Words mean a lot. So if you don't know what you're saying, then don't say. Sometimes a lot of things, for example, a thank you or an apology is not received in words. Some things 只可意会,不可言传. Not everything is spoken in words. So sometimes when we redirect ourselves to another topic or we shy away from a topic, it's out of kindness, not out of other malicious intent.
Ignorance is not that you don't know, it's that you don't even know that you don't know,
Mm,
right? So I'm ignorant in many. I'm more ignorant. There are more things I'm ignorant of than things that I can claim expertise. But at the same time, I'm open.
exactly.
I'm
Yeah.
open. I want to learn, you know. And even if you have someone that comes to you with a problem, first you have to congratulate the person for the courage. Second, you have to welcome that opportunity to learn. Yeah.
Yeah.
Okay. All
And
right.
and at the same time, if you don't know how to help that person, don't help that person. Refer that person to someone
Yeah.
who knows
Yes.
how to help the
No,
person.
I absolutely agree. Okay, so you can find both Dr. Kwok and Venerable Dihong on Facebook. They tend to be very active, especially.
LinkedIn. LinkedIn, not Facebook. Facebook is very personal for me. I don't add anyone I don't know in
Thinking.
real life.
Yeah,
LinkedIn,
but it's much
it's
more
my professional
entertaining.
platform.
It's,
Huh? No, it's boundaries. This is how you take care of yourself.
yeah.
You can keep yourself well only by protecting what's precious to you.
Okay. All right. Okay. Understood. So Lincoln. Okay. All right.
Thank you
So
so much.
okay. Thank you very much. Let me turn off. Don't leave yet. Let me just turn off all the outside link.
Okay.
All right. Hang on.